Hello and welcome to the ASCO Guidelines podcast, one of ASCO's podcasts delivering timely information to keep you up to date on the latest changes, challenges, and advances in oncology. You can find all the shows, including this one, at asco.org/podcasts. My name is Brittany Harvey, and today I'm interviewing Dr. Karen Mustian from the University of Rochester School of Medicine and Wilmot Cancer Institute in New York, co-chair on Management of Fatigue in Adult Survivors of Cancer, American Society of Clinical Oncology, Society for Integrative Oncology Guideline. Thank you for being here, Dr. Mustian.
Thank you for having me, Brittany.
Then before we discuss this guideline, I'd like to note that ASCO takes great care in the development of its guidelines and ensuring that the ASCO conflict of interest policy is followed for each guideline. The disclosures of potential conflicts of interest for the guideline panel, including Dr. Mustian, who has joined us here today, are available online with the publication of the guideline in the Journal of Clinical Oncology, which is linked in the show notes. So then to dive into the content of this episode, Dr. Mustian, what is the purpose and scope of this updated guideline on fatigue in adult survivors of cancer?
Cancer-related fatigue is one of the most common and debilitating consequences that patients experience when they go through treatment. And it can actually interfere with their ability to complete treatment and their recovery along the way. And it's not the same as a typical fatigue that you might experience from physical activity, let's say, where you can come back in and rest for a little while or take a nap or sleep, and you wake up refreshed and not feeling fatigued anymore. This type of fatigue actually needs special attention and needs to be treated with therapies. So this particular guideline is developed in a manner to help clinicians when patients present with fatigue, especially moderate to severe fatigue that can be very debilitating, help patients decide what kinds of treatments they can use to reduce this fatigue. And it's really important that this fatigue be reduced for a number of reasons, but some of the reasons we think of as being really critical are so that they can actually get their full treatment as prescribed. And then when finished with treatment, so they can actually resume their normal daily activities, they can keep working, they can keep engaging with their families, they can resume all those wonderful normal life activities that we hope for, and that their prognosis will be a good one.
Absolutely. It's critical to address cancer-related fatigue for all adults with cancer. So then this guideline covers 3 distinct patient populations and provides recommendations for each. So starting with the first section, what are the key recommendations for patients with cancer-related fatigue during active treatment?
Well, one of the things I want to mention about this guideline before I answer that question is this guideline encompasses the entire cancer trajectory. In previous guidelines for treating fatigue, we really focused on how to work with patients once they had completed their primary treatments for their cancer. This time, we're able, because the research and the literature has advanced more, to really now address what should we be doing to help patients with their fatigue while they're receiving active treatment. This can be primary treatment and or maintenance therapies, but then also once they're done with treatment and they are in the recovery stage. And then also the third area is how should we help patients with advanced cancers with their fatigue that they are experiencing? And I believe that you just asked me, how should we be working with patients really during active treatment? And this guideline, when we reviewed the literature, there's really good evidence to suggest that for people undergoing cancer treatment, clinicians should recommend exercise, cognitive behavioral therapy, mindfulness-based programs, and Tai Chi or Qigong as first-line therapy to reduce the severity of fatigue that patients can experience during treatment. We also found that the literature suggests that psychoeducation and American ginseng may also be recommended in adults undergoing cancer treatment.
Understood. Thank you for providing those key recommendations for patients with cancer-related fatigue during active treatment. So then following those recommendations, at the next point in the cancer trajectory, what does the expert panel recommend for patients with cancer-related fatigue after treatment?
Well, for survivors after treatment, the literature is also strong in that clinicians should be recommending also exercise again, cognitive behavioral therapy, and mindfulness-based interventions and programs. There's also a good amount of data to suggest that we should be recommending yoga, acupressure, and moxibustion for cancer-related fatigue after completion of treatment.
I appreciate you reviewing those recommendations as well. So then that final third population that you previously mentioned, what are the key points for the management of cancer-related fatigue for patients with advanced cancer or at the end of life?
So for patients at the end of life, we should be offering those individuals cognitive behavioral therapy and corticosteroids.
Thank you for reviewing all of those recommendations for patients with cancer-related fatigue during active treatment, after their treatment, and for patients with advanced cancer. Are there additional recommendations that were made by the expert panel that we should know about treating cancer-related fatigue? Recommendations for things that we should not be doing to treat cancer-related fatigue?
One of the things that's also characteristically different about this particular guideline update for ASCO is that this time we actually have research to suggest that there are some interventions that historically may have been used, but the research is actually suggesting that they should not be recommended at this time. So the guidelines now state that clinicians should not recommend L-carnitine or antidepressants or wakefulness agents or routinely recommend psychostimulants to manage symptoms of cancer-related fatigue. One of the things that this really highlights is the recommendation to pull back on the use of pharmaceutical products as a first-line therapy for treating fatigue, and to really look at behavioral interventions, which are showing the strongest evidence in the research in terms of effectiveness, both during treatment, after treatment, and for our patients with advanced cancer, and to really promote these behavioral interventions for patients rather than just reaching right for that pharmaceutical product. There's still instances where pharmaceuticals may be really important for patients, such as if someone tries behavioral therapies and they fail, for example, or if someone has fatigue that is just absolutely so severe that they cannot even give a good effort or attempt to trying something like exercise or cognitive behavioral therapy or mindfulness-based programs. Even considering that most of the cognitive behavioral therapy and mindfulness-based programs don't require physical activity, they're very low intensity types of behavior change. And that's really a big area where these guidelines also differ in the update from previous guidelines.
Absolutely. I appreciate you reviewing those so that we know what strategies and treatments also should not be used and how we need to tailor our interventions to specific patients and their needs. So then, in your view, Dr. Mustian, what is the importance of this guideline and how will it impact both clinicians and patients with cancer-related fatigue?
I've seen a lot of ASCO guidelines and helped with a lot of ASCO guidelines. And one of the things that I think is really great about this particular guideline for cancer-related fatigue is I'll reiterate, this is one of the most prevalent debilitating toxicities experienced by virtually all cancer patients at some point during their time being treated or in recovery. And I'm really pleased to see that the research has come far enough that we now actually have interventions that we can recommend strongly. And then we also have other interventions that we recommend that the evidence is still growing for. What's also nice about this and what's really going to be impactful for patients is, I just said, is that the recommendations are not focused on pharmaceuticals. And patients already take a lot of pharmaceutical products. We have to worry about polypharmacy and all the side effects associated with that, especially in our elderly populations. And this guideline gives clinicians and patients not just one or two, but several behavioral interventions that they can use that, if used in the correct way, as stated in the guidelines, stand a excellent chance of reducing the amount of fatigue that they experience. So it really is going to change the landscape of care for patients. It's also going to change the landscape of what clinicians have to offer in their toolkit for treating patients. And I know that, oftentimes we think it's easy for a physician to recommend a pharmaceutical product, but I also know that a lot of oncologists love being able to recommend lifestyle interventions to really help their patients with side effects and toxicities. And that's exactly what this guideline is offering. And I think it's just going to provide a wonderful place for a clinician and patients to come together to have conversations about what the guidelines say is effective and to allow them to have a conversation surrounding choice. Which one seems to be the best fit? Which one would a patient actually like to try? Which of these lifestyle interventions does the patient think they have the best chance of succeeding with, both in terms of accessing it in their community, adhering to it, being able to do it so that they can actually derive the benefits that we expect to see? That's really one of the key components of the efficacy of these interventions as well, is what really is going to determine ultimately how well these interventions work is working together to pick the one that the patient feels that they can actually do and accomplish in order to receive the benefits. It really is going to change the landscape of how we work with symptom management surrounding fatigue.
Yes, as you mentioned, it's great to have these multiple evidence-based recommendations to have a real impact for patients. You also just noted that evidence is still growing in some areas. So, what future research is needed regarding the management of cancer-related fatigue in adult survivors of cancer?
I think oftentimes when we see a guideline come out, many times people say, well, we have the answers now, so we don't need to fund any more research in that area, or maybe it becomes less of a priority. For all that we do have these treatments to recommend now, we're still really very in the early stages of being able to identify, characterize, and accurately provide therapies and treatments for cancer-related fatigue. When I look back at the history of, nausea and vomiting and where we've come in the decades of research that has ensued since the first initial findings on that, I think fatigue is still very much in its early years. Some of the things that we still don't necessarily know when it comes to these kinds of interventions, and I can tell you we struggled with in the guideline committee, is what is the actual dose of some of these behavioral interventions? I think when we prescribe a medicine, we think, oh, you need this particular dosage of this particular agent. You take it this many times a day, this many times a week for X number of weeks, and there you go. With behavioral interventions, it's a little more complex. And so, really getting down to the nitty gritty of defining exactly what type of exercise, the intensity of that exercise, exactly how many minutes a day, exactly how many minutes a week do you have to do. We weren't really able to get our recommendations refined to that degree. And I think future research that really wants to be in service of clinicians and patients should work towards defining specific prescriptions of these interventions. Exercise, I just gave that example, but it's a similar kind of approach for cognitive behavioral therapy. What are the specific components that need to be included? What does the ratio of focus on those different components need to look like? Also, the same with Tai Chi, Qigong, moxibustion, all the things, acupressure that we mentioned, really refining those specific prescriptions, I think is something that we need research on and that will take us to the next step, where we have patients doing enough that they get the effect that they want, but not wasting their time, effort, energy, and finances doing too much that they don't need to do in order to achieve the benefit that we hope for. For some of the recommendations that are not strong, we still need large, definitive, randomized clinical trials on those interventions. So, for example, we talk about that we may recommend psychoeducation and American ginseng for patients undergoing cancer treatment. We need more research in that area in order to be able to really say whether or not we should be offering that for patients undergoing treatment, and specifically those large, definitive phase 3 randomized clinical trials, talking about trials that also could be done across multiple centers where we can have more generalizable populations, different kinds of communities where those interventions are being delivered, rural dwelling communities, for example. And then, of course, there's always the need for newer and better interventions. Some of these interventions have very decent effect sizes in terms of their outcome, but it would be wonderful to actually find an intervention that completely mitigated cancer-related fatigue and it was completely gone, never to return. I think we're still in some ways waiting for that intervention to be developed. And I also would say, even though we're not recommending pharmaceuticals quite a lot in this guideline, they're not our first line therapy. There's still always the opportunity to identify molecular targets that really could help with remediating cancer-related fatigue. So there's still a plethora of research to be done out there and things that we don't know. And then lastly, and very much importantly, we need to do research in dissemination and implementation. Behavioral interventions are really challenging to deliver. So unlike a doctor recommending a pharmaceutical product where they can write a prescription and then the patient gets the prescription from the pharmacy and they have what they need, supposedly, understanding how to prescribe these interventions for patients, or even understanding how to refer them to places in communities where they can actually get a credible practitioner that is using an evidence-based approach, that is known for being one of the types of yoga or exercise or mindfulness-based stress reduction or CBT that will actually have a positive influence on fatigue, is also challenging. And so we need that dissemination and implementation research. That I do believe is going to be also really key in the next decade at changing the landscape of what this toxicity looks like in the patient experience of cancer.
Definitely. These all will be key to understand the best options for all patients, and we'll look forward to continued research in these areas to fuel future guideline updates and improve management of cancer-related fatigue in all adults with cancer. So I want to thank you so much for your work developing this guideline, and thank you for your time today, Dr. Mustian.
Oh, it's such a pleasure. I did not develop this guideline alone. I definitely want to say thank you to all my colleagues who worked very diligently and very hard on digesting the research and making these recommendations. They are representative from institutions all across the United States, a very wonderful expert panel. Thank all of them very much and give them the credit that they are due for all their hard work. And thank ASCO for supporting these efforts for clinicians and patients. And Brittany, thank you very much for having me.
Absolutely. A big thank you to the whole panel. And thank you also to all of our listeners for tuning in to the ASCO Guidelines podcast. To read the full guideline, go to www.asco.org/survivorship-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app, available in the Apple App Store or the Google Play Store. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.